Good afternoon, students. I'm going to re-record chapter 24. As you know, we went over this in class on Wednesday, and I did have a collaborate prepared for you, but that collaborate was dysfunctional um, due to me creating it last year, and it wasn't transferable for this year. So I'm going to begin for chapter 24. These are your objectives. Identify characteristics of each of the 10 personality disorders. Discuss guidelines for nursing care associated with each one of the 10 personality disorders. Analyze the interaction of biological determinants and psychological risk factors in the development of personality disorders. And we have the way we organize these to make it easier is there are 10 personality disorders, but they are clustered in cluster A for eccentric and cluster B for erratic and cluster C for anxious. So you may want to remind yourselves of these clusters, and the two most socially impacting cluster B disorders include antisocial personality disorder and the borderline personality disorder. These two in patients up most of the time the way they are identified or the way they are diagnosed is because they end up um, in the courtrooms for things that they have done, things that these disorders cause them to do and get them into. So they wind up in the legal system, and so this is the way that they are usually identified, um, and then they get care uh, after after they end up in the courtroom for whatever reason. So so you may want to download this particular slide and just kind of review these disorders and try to cluster them into these clusters in order to organize them in learning them. And then this is just the activity that we did in the classroom on Wednesday. I hope you took note of your uh, fellow students' description of these. I'm sure you did. And also, I recommend that you read and reread your chapter 24. It's not a long chapter. Just please read it thoroughly and make notes and follow your usual study habits to kind of just get familiar with these 10 personality disorders. And so we look at cluster A. They are the paranoid, the schizoid, and the schizotypical personality disorders. And for the paranoid personality disorder, we have a prevalence of 2 to 4%. It's a very small percentage of the general population. And the characteristics here are that the patients have longstanding distrust and suspicion of others, and they may be this may be apparent in childhood even. So then they have social anxiety in childhood, and they are very jealous and they're controlling as adults. And then they have an unwillingness to forgive, and they project their feelings onto others. So this is the basic characteristics of this paranoid personality disorder. And the guidelines for nursing care of this person with this disorder is to counteract the mistrust that they have, adhere to schedules, because they they will they will feed into the reason that you might have altered their schedule and think of it in a negative way, and conjure up some sort of uh, scheme that they'll conjure up some sort of reason that uh, you're targeting them for some reason. So um, Also, avoid being overly friendly with these individuals because they will just use it and turn it on you. And then use simple, direct language so that they can very easily understand and just be direct and simple and leave it there. Um, and project a neutral but kind affect so that they'll hopefully follow that lead. The treatment of group therapy is threatening to people with paranoid personality disorder. However, the group setting may be useful in improving social skills. So, role playing and group feedback can help reduce suspiciousness in these individuals. Um, so, psychotherapy versus group therapy may be in order for these individuals, and then anti anxiety agent such as diazepam might be prescribed. The physicians might prescribe this. The antipsychotic are used for the antipsychotic medications are used for more severe delusions of these individuals. And a very strong one would be Haldol, and then another one would be Timazide or ORAP. So that is your medications, and please review these in your text. The schizoid personality disorder, the prevalence of this disorder is nearly 5% of the population. The characteristics include symptoms that appear in childhood and adolescence. These folks are pretty much loners. They have poor academic performance usually. They have an increased prevalence of disordered family life, and they avoid close relationships with others, and they are characterized by depersonalization and detachment. So they are very detached from other humans, and they're very much loners. So while group therapy is not a good first treatment choice, it may be helpful after individual work with these individuals. So even though the patient may frequently be silent, group therapy provides a valuable experience in practicing interactions with others and getting feedback from others. So guidelines for nurses are to avoid being too nice or friendly. Do not try to increase socialization. Assess for symptoms the patient is reluctant to discuss, and protect against groups ridicule. And then for treatment, you have the psychotherapy, the group therapy, and you do have antidepressants, second generation antipsychotics. Both of those are used. For the prevalence, it varies from 0.6 to 4.6% in the population, and the for schizotypal personality disorder, and the characteristics are severe social and interpersonal deficits, anxiety in social situations, rambling conversations, and paranoia, suspiciousness, anxiety, and distrust. Also, brief, intermittent episodes of hallucination or delusion, and they can be made aware of their own odd beliefs. They may be vulnerable to involvement with cults or unusual religious and occult groups. So that's your schizotypal personality. And also, we need to respect the patient's needs for socialization, social isolation. Um, this is a continuation of nursing guidelines, and I apologize for getting that heading off on the border of that slide. But for the nursing care guidelines, we need to respect the patient's need for social isolation and be aware of and intervene appropriately with patient suspiciousness, and then perform careful diagnostic assessments for symptoms that may need intervention, such as suicidal thoughts. And as we know, suicidal ideation would be a red flag, and we would need to, you know, we would need to take that seriously, and we would need to take the necessary precautions if that should occur. Withhold judgment or ridicule with these patients. And then for the treatment, we need to be supportive. We need to provide supportive psychological care, um, and investigate possible involvement with the cult uh, groups, and a low dose of antipsychotics might be necessary with these individuals. And then your cluster B, your erratic cluster, would be your histrionic and your narcissistic personality disorders. And so your antisocial personality disorder and your borderline personality disorder are the two that would be very much intense personality um, disorders. So they would be the ones that would end up in the court system, or in that system of the legal system. Um, and so here you have the special considerations for those two that I just mentioned, the borderline and the antisocial, and these will be discussed at the end of the chapter for special focus. We have a case study here. Jim and Mercedes began marriage counseling together in hopes, Mercedes says, at solving their at saving their marriage. And the therapist quickly notices that Jim seems to think a lot about himself while putting um, Meredith down. It should be Mercedes or Meredith. Apologize for that typo. When she expresses hurt, he either laughs or manipulates her into feeling guilty or backing down. So the therapist also notices that Jim frequently boasts about how successful he is, as if he needs the therapist to know and admire this about him. The histrionic personality disorder. This has a prevalence of nearly 2% of the general population, and the characteristics include they are very excitable, they are dramatic, they often are high functioning, and they have bold external behaviors. They have a limited ability to develop meaningful relationships, and they have attention seeking, self centered, low frustration level, and they have excessive emotions. They may be provocative, they may be smothering to others. There is no insight into the disorder of or role in ruining relationships. So they have no insight into that or why that occurs. And the treatment is usually psychotherapy. Uh, that's a treatment of choice. And the guidelines for nursing care is to know that this this personality disorder includes seductive behavior, and that's a response to distress. And then keep the interactions professional, ignore flirtations, model concrete language for them, and help the patient clarify their inner feelings, and then teach and role model assertiveness. Assess for suicidal ideation. That's very important because they could, even though they are, you know, their characteristics are that they are dramatic. You have to take the suicidal ideations seriously because they could be very real. So we can't, just say that person's being dramatic and we kind of ignore the suicidal ideations. We can't do that. That would be unethical and not a smart thing to do. Case study. As Jim and Meredith's marriage therapist continues to work with them, she quickly discerns that Jim is not interested in changing his attitude or behaviors toward his wife. So, although Meredith, like Jim, is financially successful, Jim manages all their finances, and Meredith feels he exploits her income for his own advantage. Jim is hypersensitive to criticism and feels that as a smarter male partner, he is entitled to a greater share of control over their funds. And so, with the narcissistic personality disorder, the prevalence um, the prevalence is about from anywhere from 0 to 6%. The characteristics include feelings of entitlement, exaggerated self-importance, lack of empathy, tendency to exploit others, weak self-esteem, and hypersensitivity to criticism. They need a constant that they have a constant need for admiration, and they are less functional. They have less functional impairment than other personality disorders, so they are very functional. And so the case study continues. Jim is diagnosed with narcissistic personality disorder. Given what you know about the characteristics of this disorder, what intervention strategies would you predict to be most helpful in working with Jim? So the guidelines for nursing care include remaining neutral, promoting a stronger patient self-identity, and avoid power struggles or becoming defensive, and role model empathy for these individuals. The treatment includes that they are difficult to treat. The patients are not likely to seek help or confront shortcomings because they do not think that they have a problem. They just see this as being normal. So they sometimes are prescribed cognitive behavioral therapy or CBT to deconstruct faulty thinking, and then group therapy. They may be prescribed lithium for their mood swings. And these are continued objectives for the rest of the continuing through our presentation. We need to describe the emotional and clinical needs of nurses and other staff who work with patients who have personality disorders, and then formulate a nursing diagnosis for each of the personality disorders. Plan basic interventions for a patient with impulsive, aggressive, or manipulative behaviors, and then identify biological treatments and psychological therapies for each of the personality disorders. So cluster C, which would be anxious, the anxious cluster, the group. So we have avoidant, we have dependent, and we have obsessive compulsive. And the prevalence of avoidant personality disorder is 2.4%. The characteristics of this, we have low self-esteem, shyness, and that really increases with age, feelings of inferiority, reluctance to engage with new people, subject to depression, anxiety, and anger, and they are preoccupied with rejection, humiliation, and failure. Your avoidant personality disorder, the guidelines for nursing care are to be friendly, to be accepting, to reassure, to use those types of approaches. Don't push the patients. Um, use acceptance, uh, have acceptance of the patient's fears. And the therapy that is very helpful is group therapy. Also, exercises to enhance new social skills are helpful. And then we also can design exercises to prevent failure. So give them, allow for building of their self-esteem through being successful with the activities that we plan for them. And then assertiveness training. So those are the types of activities that these folks need. Um, the treatment modalities do include individual therapy, trust building, and assertiveness training. group therapy, and anti-anxiety agents, and then antidepressants are also utilized. For your dependent personality disorder, the prevalence of this disorder is 0.5%. The characteristics would be having a high need to be taken care of, submissiveness, fears of separation and abandonment, manipulating others to take responsibilities off their shoulders, intense anxiety when left alone, even briefly. And then the guidelines for nursing care would be to help address current stressors and set limits that don't make the patient feel punished. Also, be aware of a strong counter transference. And then use therapeutic relationship as a testing ground for assertiveness training. The treatment is psychotherapy, being the treatment of choice. Your obsessive compulsive disorder, personality disorder, the prevalence is 2 to 8% of the general population. The characteristics are rigidity, inflexible standards for others and for self, constant rehearsal of social responses, excessive goal seeking that is self defeating or relationship defeating, and a strict standards interfere with project completion, and then also unhealthy focus on perfection. So they have a very unhealthy focus for the perfection that they desire. Your guidelines for nursing care include to guard against power struggles. Remember that the patient has difficulty dealing with unexpected changes, and then provide structure but with time to complete habitual behavior. So they may have they may have a need to uh, have a longer period of time to complete their rituals that they may have developed, and they really do need to complete the rituals. It can be things like washing their hands 7 times, or bathing in the shower 3 times every time they bathe, or just whatever ritual they come up with for whatever activity or task they're doing. It's going to take more time than usual, than most people need. So the treatment for this is group and behavioral therapy, and clomipramine or fluoxetine for obsessions. Also, anxiety and depression is sometimes prescribed by the physician. And then we have the discussion here. A patient admitted to your unit has a personality disorder. What are some important areas to assess? Well, we assess, first of all, number one, we assess for suicidal or homicidal thoughts. If these are present, the patient needs immediate attention. And then number two, we determine whether the patient has a medical disorder or another psychiatric disorder that may be responsible for the symptoms, especially a substance use disorder. So use assessment about, we need to view the assessment about personality functioning from within the person's ethnic and cultural and social background. So we need to take all those things into consideration. And then we need to ascertain whether the patient experienced a recent important loss. Personality disorders are often exacerbated after the loss of significant supporting people or in a disruptive social situation. And then we would evaluate for a change in personality in middle adulthood or later, which signals the need for a thorough medical workup or assessment for an unrecognized substance use disorder. Some special considerations would be the two most challenging personality disorders. Again, I mentioned this earlier. They would be the borderline personality disorder and the antisocial personality disorder. Both are cluster B disorders, and they are these are the most complex disorders. And then the objective for this part of the lecture would just be to discuss 2 nursing outcomes for patients with borderline and antisocial personality disorders. And so we do have a case study here. Sydney is 27, is dropped near an emergency department, literally dropped. 2 of her roommates forced her bodily from their car and dropped 2 large plastic garbage bags on the ground. Sydney, who is very unkempt, stands shrieking, and an EMT standing near the outside entrance takes a few running steps to stop the car as it backs out. "What's happening here?" he says. "Sorry," says one of the women, "but we just can't take it anymore. She's uncontrollable, and we're both afraid of her. She needs help." So here she is. Here is the kind of circumstance that these folks normally find themselves in. It is a crisis situation. And borderline personality disorder is a cluster B disorder. The clinical picture includes severe impairments in functioning, emotional lability, impulsivity, self-destructive behaviors, antagonism, and splitting. And this term, the definition of this term, splitting, is inability to view both positive and negative aspects of others as part of a whole. So they have an inability to view positive and negatives. The major features of this disorder are patterns of marked instability in emotional control or regulation, impulsivity, and identity or self-image distortions. And they have unstable mood, and they have unstable interpersonal relationships. So all of this describes the borderline personality disorder. The prevalence is very small. The prevalence in society is very, very tiny. It's 1.6%, and 10% of these have suicide and mortality rate. 70% will attempt suicide. So that's very important to recognize here and understand. Borderline personality disorder patients often have another mental illness as well. And substance use disorders are usually greater than 50%. So 50% of the time they're trying to self-medicate themselves. The risk factors here they have a high genetic association for their disorder. They have that is a neurobiological issue most of the time. It's very highly there's a high risk for neurobiological disorder or associations here. And for cognitive, they have separation and individualization. So we have a case study continued from the first part of the case study. Sydney, the young woman who was dropped nearby an emergency department by her roommate, is brought into the emergency department, sobbing and shrieking the entire time. She has evidence of cutting up and down her arms, and she shouts curses at each female nurse and refuses to cooperate, saying that she is tired of everyone trying to tell her what to do. She calms down a little when a male nurse approaches. When asked why that helps, she says, "Women are jerks. Never trust other women. They're all mean." So we have a question here, a practice question. Sydney is admitted to the psych unit for evaluation. Which behaviors would be consistent with a diagnosis of borderline personality disorder? Would it be splitting? Would it be inflexible standards? Lack of empathy, absence of remorse, and finally A and B. Well, the answer is A for splitting. Borderline personality disorder is characterized by splitting, that is, seeing people in terms of bad or good with few in betweens. An example from Sydney is her statement that women are jerks in response to effect of a male nurse and is no doubt an impulsive response to her recent traumatic break from her female roommates. Inflexible standards is consistent with obsessive compulsive disorder, not borderline personality disorder. That's why that would be not correct. The number B would not be correct. And then similarly, lack of empathy and an absence of remorse. This is not demonstrated in our patient at this time. So they are both associated with antisocial personality disorder and not borderline personality disorder. So this one, this borderline personality disorder is very, very complex. It's very interesting. I want you to make sure that you read the entire chapter. For chapter 24, make sure you understand these 10 personality disorders, and especially the borderline personality disorder, because it's more complex. Okay, the nursing process for borderline personality disorder, the assessment would include a semi-structured interview, and the use of MMPI, a self-assessment. Also, nursing diagnoses could be risk for self-mutilation, risk for suicide, risk for violence. And by the way, risk for suicide would be the number one. It would be above, it would be higher importance than risk for self-mutilation. The third one there is risk for violence, and then social isolation, impaired socialization, disturbed personality identity or disturbed personal identity, and difficulty coping. So patients with personality disorders often enter psychiatric treatment because of distress from a comorbid mental illness. So in other words, they have more than one thing going on mentally. And then for the nursing process, outcomes and planning, some of the diagnoses, nursing outcome classification, scales for measuring improvement would be utilized. And then there's an importance of the therapeutic relationship, and we've talked about therapeutic communication. Avoid manipulative behaviors. And then for implementation, provide clear and consistent boundaries. We have to keep reiterating this for our patients, or they'll manipulate these boundaries. So use clear, straightforward communication and calmly review therapeutic goals. Teamwork and safety is very important. Remember what we said initially in our courses, in our course lectures. Don't let the patient be in between you and the doorway, because you may have to make an escape if you're in their room with them. And then respond matter-of-factly to superficial self-injuries. Don't over uh, dramatize the situation, because they'll feed off of that. And that's what they're a lot of times that's what they're looking for, is a drama. So finding the best approach that works with patients in the setting in which they are treated is very important. Therapies such as dialectical behavior therapy and mindfulness-based therapies offer staff evidence-based interventions. It also offers clinical structure and formalized support for identifying the best practices for your nursing actions. The treatment modalities include biological treatment, the psychotropics geared toward uh, symptom relief here. And so the psychological therapies include the CBT that we've discussed, also dialectical behavior therapy, the DBT, and the schema-focused therapy. So finding the best approach that works with patients in the setting in which they are treated is so important. Therapies such as dialectical behavior therapy and mindfulness-based therapies offer staff evidence-based intervention and clinical structure and formalized support for identifying the best practices in mental health care. And so, which behavior indicates that Sydney, our patient diagnosed with borderline personality disorder, is improving? Is it A, she cries when her roommate refuses to go to the dining room with her? Is it B, she yells at the group facilitator when he points out that she is monopolizing the group? Is it C, she informs a staff member that she is having thoughts of harming herself? Or is it D, she tells the evening staff that the day staff excused her from the group to smoke when she got upset? Well, the answer is C. It looks as though D is bolded, but I think that's a mistake. The answer would be C. She informs a staff member that she is having thoughts of harming herself. So really, that's not a good thing, but it's a good thing in that she is letting us know that that is going on. She's reaching out. She's reaching out for help. The antisocial personality disorder is also a cluster B disorder. The prevalence is small, 1.1%. The characteristics include uh, antagonistic behaviors, dis, um, disinhibited behaviors, profound lack of empathy, absence of remorse or guilt, and symptoms peak mid-teens to 20s. The symptoms may abate and improve on their own by age 40. So this personality disorder is very concerning, and this is definitely one that would find itself in the court system and in the legal system. And the main pathological traits that characterize antisocial personality disorder are antagonistic behaviors such as being deceitful and manipulative for personal gain or hostile if needs are blocked. So this disorder is also characterized by disinhibited behavior such as high risk taking behavior, disregard for responsibility, and impulsivity. So criminal misconduct and substance abuse are common in this population. So this is just very important that you understand which one this is and you know understand the difference in this one from the borderline personality. Um, so the assessment includes patients with antisocial personality disorder become defensive and do not tend to answer honestly. So we need to be on guard for that, and just be aware of that they will they will be dishonest. So we have to watch for that, and um, not be prey to that. And then their self-assessment is important. And so there are tools that we use for their self-assessment. The nursing diagnosis includes risk for violence, impaired impulse control, impaired social interaction. So again, we need to make sure that we are not caught between them and the door when we're intervening, when we're interacting with these patients. And then the outcome would include abusive behavior, self-restraint, aggression, self-restraint, coping, social interaction, social isolation knowledge, and then health promotion knowledge, health promotion behavior. We're going to be teaching them how to help themselves, and the nurse will be the expert in this area. And these will be difficult to accomplish because of the type of behavior that this individual will be exhibiting, and they obviously will not be able to trust them that far. So maintaining safety is the priority for the patient as well as for the nurse. For planning and implementation, we need to keep those boundaries. We need to consistently support, but also keep the limits, uh, maintain those limits that we talked about. Um, Help them to focus on realistic choices and the therapeutic communication versus manipulation. We need to make sure that we're using therapeutic communication, but also that they are responding with communication that is honest and um, And the only thing that we can do is not to give in to the manipulation usually. Teamwork and safety is very, very much a priority. Um, and pharmacological interventions include the mood stabilizers. And then your evaluation, it is difficult um, and maybe unknowable. Uh, we might not be able to correctly evaluate what has been helpful for these patients, is what this is saying. And then the motivation for the patients may learn to change their behaviors because of their motivation to be better, to get well, maybe to get increased perks in their environment, what have you. But we need to address the manipulative behaviors, especially bullying openly, along with consequences or loss of privileges in their setting, in their milieu. And then we anticipate and seek team support for the aggressive behaviors. And we reduce their anxiety and anger through physical outlets. So this is important, and it has to be a team effort to be successful in these endeavors. And then treatment modalities. There are no specific medications here. Mood stabilizers may help with aggression. Also, it's possible that the SSRIs and the benzodiazepines or Ritalin may be helpful, and that's the physician's call. And the psychological therapies, there is some evidence that this patient population may bond with psychotherapists, and then the use of CBT, um, mentalization behavior therapy, MBT. This is a long-term treatment that supports the individual's ability to recognize and understand his own and other people's mental states, as well as to help them examine thoughts about themselves and others. The dialectical behavior therapy, that is similar to the CBT, it focuses on regulating emotions and being mindful. It is also useful in treating antisocial personality disorders. So these are some promising um, therapy treatment modalities. And so here's a practice question. Perfection is a trait likely to be evident in a person with which personality disorder? Obsessive compulsive, narcissistic, antisocial, or avoidant? The answer is A, obsessive compulsive. Persons with obsessive compulsive personality disorder do try to control the environment through perfectionism and orderliness. So that is something that this practice question is a very good practice question for you. Um, and so then antisocial, obsessive, compulsive, and schizotypal personality disorders occur most frequently in, is it adolescents, is it children, is it women, or is it men? And the answer is D, men. The prevalence rate for antisocial, obsessive, compulsive, and schizotypal personality disorders are highest in men. Here's an NCLEX practice question. The nurse should recognize which factors that distinguish personality disorders from psychosis. So is it functioning is more limited in personality disorders than in psychosis? Major disturbances of thought are absent in personality disorders. Personality disordered clients require hospitalization more frequently, or personality disorders do not affect family relationship as much as psychosis. The answer is B. And major disturbances of thought are absent in personality disorders and are a classic symptom of psychosis. So that is your answer. That's your NCLEX question. Another NCLEX question, practice question. Which characteristics should a nurse recognize as being exhibited by individuals diagnosed with any personality disorder? Is it A, these clients accept and are comfortable with their altered behaviors? Is it B, these clients understand that their altered behaviors result from anxiety? C, these clients seek treatment to avoid interpersonal discomfort. Or D, these clients avoid relationships due to past negative experiences. And the answer is A, clients who are diagnosed with personality disorders accept and are actually comfortable with their altered behaviors. Personalities that develop in a disordered pattern remain somewhat unstable and are unpredictable throughout their lifetime. But these people really do believe that what they are experiencing is normal, and it's normal for them. So they believe it to be acceptable, and they are perfectly comfortable with it. Another NCLEX question. Looking at a slightly bleeding paper cut, the client screams, "Somebody help me quick, I'm bleeding. Call 911. A nurse should identify this behavior as characteristic of which personality disorder? Is it schizoid personality disorder, obsessive compulsive disorder, histrionic personality disorder, or paranoid personality disorder?" And so it's C, histrionic personality disorder. Just think of hysterical for that one. Self-dramatizing, attention-seeking, over-gregarious, and seductive. Those are words to describe this one. A highly emotional client presents at an outpatient clinic appointment wearing flamboyant attire, spiked heels, and their theatrical makeup. Which personality disorder should a nurse associate with this assessment data? Is it compulsive personality disorder, schizotypal personality disorder, histrionic personality disorder, or manic personality disorder? And this one would be C, histrionic personality disorder. The nurse should associate histrionic personality disorder with this assessment data. The nursing instructor is teaching students about clients diagnosed with histrionic personality disorder and the quality of their relationships. Which student statement indicates that learning has occurred? A, their dramatic style tends to make their interpersonal relationships quite interesting and fulfilling. B, their interpersonal relationships tend to be shallow and fleeting, serving their dependency needs. C, they tend to develop few relationships because they are strongly independent but generally maintain deep affection. D, they pay particular attention to details, which can frustrate the development of relationships. Okay, so the answer is B. The instructor should evaluate that learning has occurred when the student describes clients diagnosed with histrionic personality disorder as having shallow, fleeting, interpersonal relationships that serve their dependency needs. While improving, a client demands to have a phone installed in the intensive care unit or ICU room. When the nurse states this is not allowed, it is a unit rule, the client angrily demands to see the doctor. Which approach would the nurse use in this situation? Would the nurse provide an explanation for the necessity of the unit rule? B, assist the client to discuss anger and frustrations. C, call the physician and relay the request. Or D, arrange for a phone to be installed in the client's room. And the answer is B. Clients who demand special privileges may be diagnosed with narcissistic personality disorder. The best approach in this situation is for the nurse to identify the function, uh, the anger, frustration, and rage serve the client. And the verbalization of feelings may help the client to gain insight into his or her behavior. So, and this is another practice question. Which statements represent positive outcomes for clients diagnosed with narcissistic personality disorder? Select all that apply. A, the client will relate one empathetic statement toward another client in the group by day 2. B, the client will identify one personal limitation by day 1. C, the client will acknowledge one strength that another client possesses by day 2. D, the client will list 4 personal strengths by day 3. And E, the client will list 2 lifetime achievements by discharge. And so the answer is A, B, and C. And the nurse should determine that appropriate outcomes for a client diagnosed with narcissistic personality disorder include relating empathetic statements to the other clients, identifying one personal limitation, and acknowledging one strength in another client. An exaggerated sense of self-worth, lack of empathy, and exploitation of others are characteristics of narcissistic personality disorder. Which reaction to a compliment from another client should a nurse identify as a typical response from a client diagnosed with avoidant personality? A, interpreting the compliment as a secret code used to increase personal power. B, feeling that the compliment was well deserved. C, being grateful for the compliment but fearing later rejection and humiliation. And D, wondering what deep meaning and purpose are attached to the compliment. And the answer is C. The nurse should identify that a client diagnosed with avoidant personality disorder would be grateful for the comment but would fear later rejection and humiliation. We have another NCLEX question here. Family members of a client ask a nurse to explain the difference between schizoid and avoidant personality disorders. Which is an appropriate nursing reply? A, clients diagnosed with avoidant personality disorder desire intimacy but fear it, and clients diagnosed with schizoid personality disorder prefer to be alone. B, clients diagnosed with schizoid personality disorder exhibit odd, bizarre, and eccentric behavior, while clients diagnosed with avoidant personality disorder do not. C, clients diagnosed with avoidant personality disorder are eccentric, and clients diagnosed with schizoid personality disorder are dull and vacant. D, clients diagnosed with schizoid personality disorder have a history of psychotic thought processes, while clients diagnosed with avoidant personality disorder remain based in reality. So the answer is A. The nurse should educate the family and client that clients diagnosed with avoidant personality disorder desire intimacy, but they fear it, while clients diagnosed with schizoid personality disorder prefer to be alone. Which adult client should a nurse identify as exhibiting the characteristic of a dependent personality disorder? A physically healthy client who is dependent on meeting social needs by contact with 15 cats. B, physically unhealthy client who has a history of depending on relationships to meet basic needs. C, a physically healthy client who lives with parents and relies on public transportation. D, a physically unhealthy client who is serious, inflexible, perfectionistic, and depends on rules to provide security. And the answer is C, a physical healthy adult client who lives with parents and relies on public transportation exhibits signs of dependent personality disorder. Dependent personality disorder is characterized by a pervasive and excessive need to be taken care of that leads to submissive and clinging behaviors. The nurse plans to confront a client about secondary gains related to extreme dependency on spouse. Which nursing statement would be most appropriate? A, do you believe dependency issues have been a lifelong concern for you? B, have you noticed any anxiety during times when your husband makes decisions? C, what do you know about individuals who depend on others for direction? And D, how have the specifics of your relationship with your spouse benefited you? And the answer is D. When a client goes to excessive lengths to obtain nu- nutrients and support from others, the client is seeking secondary gain. Secondary gains provide clients the support and attention that the client might not otherwise receive. So this is also an open-ended question. And the nurse tells the client that the nursing staff will start altering weekend shifts. Which response should a nurse identify as characteristics of clients diagnosed with obsessive compulsive personality disorder? A, you really don't have to go by that schedule. I just stay home sick. B, there has got to be a hidden agenda behind the schedule change. C, who do you think you are? I expect to interact with the same nurse every Saturday. And D, you can't make these kinds of changes. Isn't there a rule that governs this decision? And so the answer is D. The nurse should identify that a client diagnosed with obsessive compulsive personality disorder would have a difficult time accepting change. This order is characterized by inflexibility and lack of spontaneity. And individuals diagnosed with this disorder are very serious, they're very formal and over-disciplined and perfectionistic and preoccupied with rules. I think this is the last one. Okay, so which client symptoms should lead a nurse to suspect a diagnosis of obsessive compulsive personality disorder? A, the client experiences unwanted, intrusive, and persistent thoughts. B, the client experiences unwanted, repetitive behavior patterns. And the client experiences inflexibility and lack of spontaneity when dealing with others. And D, the client experiences obsessive thoughts that are extremely imposed. And the answer is C. So the nurse should suspect a diagnosis of obsessive compulsive personality disorder when a client experiences inflexibility and lack of spontaneity. Individuals diagnosed with this disorder are very serious, formal, and have difficulty expressing emotions, and they are perfectionist and preoccupied with rules. So I hope these practice questions will be helpful to you. And I would, I would recommend reading your entire chapter 24, and just making sure that you can identify um, specific traits and nursing nursing care for individuals with the 10 personality disorders. Pay attention to the clusters that can be helpful for you. And please use the slides that I identified that you can print out and study to make sure that you're understanding those clusters very well. Don't forget your national patient safety goals. You will be responsible for that material on your test as well. And we should be going over a test review, which will include Halter Chapter 18, Halter Chapter 24, as well as the National Patient Safety Goals for 2026. I look forward to seeing you. Stay safe over the weekend. Thank you so much.